All right, I'm gonna open the airway. Can you get the bag, please? Yeah, no problem. Thank you. All right, can somebody get the Narcan? All right, I'm gonna get the Narcan. It doesn't look like there's any trauma here. So this looks like an opiate overdose. She has the tourniquet still around her arm, and there's some paraphernalia here. We're going to give 2 milligrams intranasal Narcan for possible opioid overdose. Intranasally. It's been administered. Okay, let's move her over to the Mega Mover and get her on the stretcher. Will you grab the Mega Mover, please? All right, I'm gonna go get the Mega Mover. Great, thank you. So we did 2 intranasally of Narcan on scene, and it didn't even touch her. So will you start an IV, and we'll do another 2 of Narcan and see if it helps? Yeah, I'll get the IV started. All right, I got the Narcan. You got that IV? Yeah, I got the IV. I'm ready. So this is a suspected opiate overdose, and we've already given 2 of intranasal Narcan. So we're going to give another 2 of Narcan IV. That's 2 mLs of Narcan. Copy that. 2 milligrams of Narcan, 2 mLs. This is going to be an IV push for possible opiate overdose. So if this 2 of Narcan doesn't wake her up, then we need to prepare for intubation. Will you get me set up? Let's talk about overdose. When you approach a patient, always work through your systematic approach. When you work through your ABCs, make sure that you assist the patient's ventilations if the patient needs ventilation assistance. In this case, it was evident that it was an overdose. But if you find an unresponsive patient, make sure that you work through some differential diagnoses and check a blood glucose if the patient's unresponsive. We know that this is an overdose because the paraphernalia is on scene in this patient's history. You can give 4 milligrams of Narcan intranasally if you know that your patient needs it rapidly. If your patient isn't maintaining their own airway, if their color isn't looking good, you'll find this all out during your primary assessment. That's why it's important to do your primary assessment before you administer any medications. If your patient is awake and they're starting to be lethargic and their vital signs are stable, you can consider starting an IV and giving 0.4 milligrams of Narcan IV. Don't intubate these patients before giving the Narcan time to work. It's important to use crew resource management and talk to the people around you and do a MAC check before you administer medication. This will help you so that you don't make a medication error and you'll hear views from other clinicians on scene. One more reason that it's important to follow the systematic approach and do a full assessment on your patient is because you don't ever know what drug your patient took. It's possible that this patient was injecting something else. When you look at the patient's heart rate and you look at the patient's pupils, that helps you to figure out what the patient took. So make sure that you're always using the systematic approach and doing a full assessment on your patients.